Hello, Red Jacket families and staff. Thank you for joining us. I'm Charlene Dean, Superintendent of Schools, and I'm here with Jeff McCarthy, Elementary School Principal, Karen Hall, Middle School Principal, Christy Curtin, Coordinator of Special Services, and Tim Burns, Business Administrator. You may have heard that schools are not receiving guidance from the Governor's Office or the New York State Department of Health anytime soon. The New York State Education Department is currently working on providing guidance. Therefore, aspects of this reopening plan are subject to change. The Ontario County Superintendents felt we could not wait any longer for guidance to come out with school starting so soon. As a result, we've been engaged in meetings with the Ontario County administrators and the Ontario County Department of Public Health to develop reopening plans that are consistent with one another, supported by Ontario County Public Health, Ontario County administrators, our school nurses, leadership team, and others. Our collective goal is to provide a safe in-person education for our students 5 days per week. As you know, schools have been sharing vaccination clinic information, assisting our staff and community in getting vaccinated, and we've held our own vaccination clinics. It is estimated that over 80% of our staff at Red Jacket is vaccinated. I cannot give a more accurate number because we're not privy to vaccination records. Schools are not requiring staff to be vaccinated unless there is a New York State law or federal law requiring employees to be vaccinated. Therefore, the safety measures we have in place apply to everyone regardless of vaccination status. I've asked members of our leadership team to join me today to share components of our reopening plan draft. So Jeff, will you please address the use of masks for us?
Sure. Our plan uses Ontario County transmission level designation data from the CDC to determine when masks are to be worn inside. This information can be found by searching CDC COVID data tracker. There's essentially 4 transmission rates that we'll be using this year when we communicate with staff and families. They are low, moderate, substantial, and high. These are the CDC transmission level designations. When Ontario County has a low or moderate transmission rate, masks will be strongly encouraged, but not required in school for staff, students, and visitors. When Ontario County has a substantial or high transmission rate, masks will be required for staff, students, and visitors. Despite the transmission rate, staff, students, and visitors always have the option to wear a mask. In general, masks do not need to be worn outdoors during recess, playing PE, or during outdoor play activities. However, during substantial and high transmission levels, people who are not fully vaccinated are encouraged to wear a mask in crowded outdoor settings or during activities that involve sustained close contact with other people. When activities, PE activities or recess are held indoors, masks must be worn when a substantial or high transmission level is designated. Distance should always be maximized as much as possible in all settings. Masks will always be required on school buses because distance cannot always occur and because students and drivers will be in confined spaces together. Once a week, every Friday afternoon, the Ontario County Department of Public Health will inform in Ontario County schools of the transmission level, and that designation level will be used from Friday to Friday. Each week, we will send out a Friday afternoon parent square message notifying families and staff of the designation level for the upcoming week. So for example, if public health notifies us on Friday that the designation level is moderate, then masks in school will be strongly encouraged, but not required for the following week. On the other hand, if Ontario County notifies us on a Friday that the transmission level is high, then masks will be required in school for the following week.
Thank you, Jeff. It's important to note that Ontario County Department of Health would like Ontario County schools to consider volunteer surveillance testing if we are at a substantial or high transmission level. This testing would be funded through a grant the county is trying to obtain. This would be done on a voluntary basis and parental consent would be required before any students were tested. The CDC recommends that for screening testing to be effective, testing should be done at least once per week and rapidly report the results within a 24-hour period. Testing information will be shared at a later time if Ontario County receives the testing grant. And again, if it's done, it will require parental permission. Karen, as you know, previously, the New York State Department of Health required schools to have a minimum of 6 feet of distance between students and classrooms. Our classrooms and other spaces did not have enough square footage to allow for 6 feet of distance. Later, the New York State Department of Health relaxed the distancing requirement at the elementary level to 3 feet. This allowed us to bring our elementary students back to in-person learning, while our middle and high school students remained in the hybrid model. Our updated plan uses the CDC transmission designation level for distancing. Karen, will you please explain distancing in school under our new plan?
Sure. Distancing in school will not be required when Ontario County has a low or moderate rate of transmission. If Ontario County is considered to have a substantial or high rate of transmission, 3 feet of distance will be required where possible. As Jeff shared, masks will also be required under substantial or high transmission levels. Cohorting will be used as much as possible in classes and during meals. We will maximize physical distance as much as we can when students are moving through lunch lines and eating. Each table in the cafeteria will become a pod and will be subject to quarantine if there was an exposure. Students will remain in the seats they select at the secondary level with their classmates at the elementary level. This makes contact tracing easier and limits potential exposure. There will be no distancing requirement on school buses because, as Jeff shared, all passengers and drivers are required to wear masks on the bus. Students will have assigned seats for contact tracing purposes. When the outdoor temperature is mild, such as 40 degrees or warmer, and there's no precipitation, drivers should open the roof hatches and some of the windows, at least partially, to allow for airflow. Teachers are also encouraged to partially open their classroom windows on mild days as well to increase airflow.
Thank you. Christy, can you share with us how health screening will be conducted and explain how our plan addresses students with disabilities or students with healthcare needs?
Absolutely. A daily screener through parent score will no longer be required. Instead, all staff and students will stay home if they are sick. For instance, exhibiting symptoms of infectious illness, such as the flu or COVID-19. Staff or parents should call their healthcare provider or pediatrician for testing and care, and they should communicate with our school nurses. They should also request a doctor's note for documentation to provide to the school nurse or their building principal as well. If it is possible, then we may go back to using the Parent Square Daily Screener if and when Ontario County reaches and remains at a substantial or high transmission level. With regard to students with disabilities, all accommodations, modifications, and support will be provided in school as they would normally. Service providers who provide services at other school locations will report to us whether or not the other locations have had COVID cases so we can take appropriate precautions. I work closely with our principals and counselors on schedules, and we try to maintain consistent and use cohorting as much as possible. We also have masks with clear fronts for staff to use with students who are working on speech and or have hearing deficits and need to see or read lips.
Okay, thank you, Christy. Tim, will you please explain the process for facility use by outside organizations and occupancy limits?
Yes, of course. Organizations who wish to use the school facilities must go on our school website, click on the community tab, and then click on the RJ Community Facility Use Request and follow the instructions for making a request. The request will be approved or denied based on whether or not the space is available and the Ontario County transmission level designation for the week may also be a determining factor. If we have a low or moderate designation level, there will be no occupancy limits. If we have a substantial or high designation, indoor occupancy will include a minimum of 3 feet of physical distancing and masks will be required. Occupancy may be limited to 50% or more, or may not be permitted. depending on the circumstances. There are no occupancy limits for outdoor activities. The location of the facility used will be a key factor, with increased access more likely for outdoor areas. Individuals or organizations using the facilities must follow all health and safety protocols in place by the district. Additionally, with prior notice and approval, visitors to our school will be permitted. They must have their license scanned through our Raptor system, answer health screening questions, have their temperature taken, and get a visitor badge.
Thanks, Tim. And can you share with us anything about school-sponsored sports and extracurricular activities?
We anticipate detailed athletic guidance to be provided from the New York State Public High School Athletic Association in the coming days, and we will comply with their guidance unless it conflicts with our reopening plan. In this case, we will consult with our school legal counsel.
Okay, thanks, Tim. I anticipate mitigation and prevention strategies to be part of the athletic guidance that we receive. When it comes to mitigation strategies in school, we will continue to provide training to staff and our students on proper hand washing, use of sanitizer, covering coughs and sneezes, cleaning and disinfecting, and including the proper way to wear a mask. Ventilation is also an important prevention strategy that can reduce the number of particles in the air, along with other preventative strategies, including wearing a well-fitting multi-layered mask, bringing fresh outdoor air into the building, which helps keep virus particles from concentrating inside. As Karen shared earlier, this can be done by opening classroom doors and windows. Fans can also be used to increase the effectiveness of windows. Staff are encouraged to keep windows at least partially open on mild days. Also, the airflow in occupied rooms is set to a minimum of 15 cubic feet per minute per occupant. And all our filters are MERV filters that are within the approved range. Our maintenance department uses the master library system to track filter changes and the other preventative maintenance work that they do. A schedule has been set up to make sure filters are changed in accordance with the recommended schedule established for specific filters. We've learned that the virus is aerosolized and does not stay on surfaces. Our classrooms and all our other spaces will continue to be thoroughly cleaned and disinfected by our hardworking cleaners each night. However, we are relaxing the disinfecting that our staff was doing between classes. Teachers will continue to be responsible, just like they always have been, for keeping their classrooms generally cleaned, picked up, organized, but they're not expected to disinfect between classes. Our staff will be provided with cleaning supplies that will be stored out of reach of students that they can use as they feel is needed. And when they need more supplies, they should certainly request them. Our cleaning staff will once again use the cleaning logs, which are located outside of every space beginning on September 7th. Jeff, last year you worked closely with our elementary school nurse, Sarah Huber, to complete contact tracing. Could you explain the process?
Sure. When a staff member or student has tested positive for COVID, which is typically community acquired, we receive a call from public health, a parent, or that staff member. Once we receive information that a person has tested positive or is symptomatic, we work with public health to determine who they may have come in contact with. Public health will ask a series of questions because the length of the contact, whether the contacts were wearing masks or not, or whether or not the contact was vaccinated, makes a difference in how they respond. Those who test positive for COVID are required by the Department of Health to isolate for a period of time, and those who are in close contact are required to quarantine. The New York State Department of Health makes those determinations, though.
Okay, thank you. If a teacher's class is quarantined and the teacher is not sick, he or she will be able to teach online from home, and the teachers of the other classes will teach synchronously or asynchronously to provide instruction to those who are quarantined and or in isolation. Otherwise, virtual instruction or the hybrid model will only occur if the New York State Department of Health or the New York State Department of Education or other governmental agency requires schools to implement 6 feet of distancing or requires us to provide these other methods of instruction. Parents should contact their school principal if their child has a medical condition that does not allow them to be educated in school. If a complete school closing is required, the decision will be communicated as soon as possible and the district will move to online instruction. Karen, can you share with us how we will address field trips?
Absolutely. We are going to proceed cautiously with field trips. All of our school protocols will be in place on field trips, including the CDC transmission designation for the destination for decision-making. Money should not be allocated toward non-refundable field trips since they may need to be canceled due to COVID. We will disclose these risks to our families and we will strongly encourage trip insurance.
Okay, thanks. Christy, are there any changes to homeschooling?
Oh, homeschooling is continue to be governed by the regulations of the New York State Education Department. Parents wishing to homeschool a child must follow the published guidelines, including submission of an intent to the homeschool and an individualized home instructional plan. The State Education Department has also published a Q&A document on their website, which supports parents in the homeschooling process. And parents should contact our district office if they intend to homeschool their children or child.
Okay, thank you, Christy. Our plan includes 3 different levels of instruction. Level 1 is in person. Level 2 is the hybrid model of learning, and level 3 is online learning only. We included the plans for hybrid and online learning because the circumstances might change and we may need to implement them. Hopefully that will not happen. Our expectation is that we will be providing in-person instruction 5 days per week for our students beginning September 7th. We recognize that there's not one plan that will incorporate everything everyone wants or includes everything that everyone thinks should be included. Our goal, however, is to create a reasonable plan that provides our staff and students with a safe in-person instructional model. The 2021-2022 reopening plan will be on our school website, and we will provide a link to the plan through Parent Square. There will be also a link to a Google form where comments can be made regarding the plan. Our staff and families will have an opportunity to ask questions and make comments regarding the plan starting now through Friday, August 20th until 3 p.m. And our plan will be accessible, like I said, on the website at www.redjacket.org. All right, thank you, everyone.